L'audio va bene?
Good afternoon, ladies and gentlemen. Welcome to the Aitness presentation. For us, it's a pleasure to present this project that has been created and developed in the last years and that we want to share with you because it's really innovative in the medical and biotechnological sciences. And now we will explain to you what are we doing and how can we help you. And for this, I will just thank you to be here, your interest. You have in all our channels that we are streaming. Open the chat to make all questions you want. We will dedicate that at the late part of the presentation some minutes for that. And now I will introduce Dr. 𝗬𝗺𝗺𝗀, the medical director of Aitness, to explain us the vision of the company. Please, Doctor.
Thank you, Mr. 𝗬𝗺𝗺𝗀. The idea become a project where we realized that using immunotherapy competent cells, autologous immunotherapy competent cells, we could release all the chronic systemic inflammation and reduce it. And that's the main question, that most of the chronic disease that do not have treatment at this moment, or they have very few type of treatment, only symptomatic, and they are not really helping for that sicknesses, we can be able to reverse the effect and to really find a solution for these sicknesses. So the idea was first working with this competent immunotherapy cells from the patient, autologous cells, using these autologous cells and making a very innovative system. We have been able to reverse the inflammation, the inflammatory systemic effects, and we have been able to minimize these sicknesses, this disease, and some of them we are able inclusive to achieve cure. Not in all the cases, but we have achieved a very good reactions, and we have been able to minimize all the effects of autoimmune sicknesses. After that, we will make a list of all the sicknesses we are able to treat, and we have been able to find solutions that are without side effects, without reactions, very few reactions, very few, only like a little bit of pain, fever, but very few, and with a very high solution to the problem. So then we saw that this would be the solution for this type of sicknesses that do not have any type of solution. So now I want to introduce Dr. Vidal, that he's our biotechnologist expert, and he will explain you a little bit about what we are doing with this type of cells. Dr. Vidal, please.
Thank you, Doctor. Hello, everybody. Thank you for attending this event. So let me tell you a little bit about which is my task. My task is focused on research and development of new products for using in the human use, then to treat those patients which is affected by inflammation, as you know. So we are very pleased to explain you a little bit later on, probably later on, in more details what about we are working, what about we did, what about our results, what about our data. So thank you very much for attending this event, which is, I hope you will enjoy it. I hope so. Okay, so for the time being, so later on, we will explain in more details, and also we expect from you some questions. I hope you have many. Okay, let me also let you stay with me here. Okay,
thank you very much. Paco. Our colleague, Dr. 𝗂𝗺𝗺𝗪 is just going out from surgery now in the hospital. Then he will join us later, and I will introduce this part. And this part is about the company project. We are just negotiating and opening new medical centers in Andorra and in Switzerland in this first stage. In a second one in Dubai and Emirates, probably in the third one in the United States. Then we have opened a collaboration and cooperation program with all medical tourism agencies, hospitals, and universities, just to allow us to cooperate and make this research and investigation that Dr. Vidal was explaining. Then we are absolutely open. Please contact us about your patients' cases, and we will study and we will cooperate to help them and to work together. And then after this introduction, let's go for the core of this presentation and the therapeutic and medical approach that will be presented by Dr. Lusberg. Please, Dr.
We have a list of disease that we have been able to, maybe in some cases, cure, and in many cases, improve. Most of the we are speaking about disease that do not have a treatment nowadays and do not have some real therapeutic approach that will give us a solution. For instance, I'm speaking about 𝗁𝗺𝗃𝗃 of 𝗁𝗁𝗃𝗃 of 𝗁𝗁𝗃, autoimmune disease. We have been able to, and we control it because we have some parameters that will give us the idea of what's going on. For instance, anti-TPO, that we know exactly what's going on with the attack of the immunitary system against the thyroid cell, and we have been able to reduce it 100 times less than what it was. People that had 2,000, 5,000 TPOs, reduce it to 100, reduce it to 50, reduce it to 75. That means maybe we have not cured it, but the response has been absolutely that, and all symptomatology has disappeared, and they don't have to take any type of medication because the problem is controlled. We have been able to doing it through the control of the systemic inflammation. That's the idea, the core idea. Using autologous cell of the own patient, that we find the immunocompetent cells, and Dr. Vidal makes the approach, give us the scientific product to give these persons, put them on function, and in about 8-12 weeks, we obtain the results and we see how this is working. We find a very, very good solution on this one. Arthritic rheumatoid arthritis. We have seen in these sicknesses that we can reduce 10 times the symptomatic effects with no side effects, without reactions, without only symptomatic release of all the pain, symptomatic release of the sickness, with all the parameters, analytic parameters that we can analyze, and we see how they have become not normal, but almost normal. So we think that this is a very good approach. This takes a little bit longer. We need maybe sometimes 1 year to obtain the results. Lyme disease. We have been able to quit all the effects of Lyme disease. We have been able to, we say cure, because after 5 years, no side effects, no reactions, no, it doesn't come again, so it has disappeared. So we think it's a cure of Lyme disease. Of course, it's not simple. It's not immediately. We need a first approach, and maybe sometimes we need a second approach to it. After 6 to 8 months, we need to insist again, because it's not simple to resolve. But at the end, we find that this disease, we have been able to make it disappear absolutely. Lupus, we have had an approach to lupus, and we found out that we have been able to reduce it more than 75%. That's a good relation with no side effects again, with the own cells of the person, and with a good symptomatic response. Maybe we have not cured it, but we have obtained very, very good results, and people feel that they are cured because they don't have symptomatology, they are not taking any medication, so the thing is working. We have worked on Crohn's disease and all the inflammatory bowel disease. Inflammatory bowel disease are a very good reaction, they react very good to our treatment, and we are obtaining excellent results. Some of them we think cure, but as most of them, they have almost 5 years of experience, and in 5 years we didn't see this disease did not appear again, no symptomatic. All the trials that we have made, all the analysis that we have made, it seems that it's all disappeared. So we think that all the inflammatory bowel disease, we are able to have a very good chance on them. And by the moment, they don't have other type of approach with the medical, traditional medicine that we have in the market. We have tried on sclerosis, multiple sclerosis. We found solutions, we found reactions, we found improvement. Of course, it somehow depends on the chronicle of the sclerosis. As it's more chronic, it's more affected. So we will see the reaction that will be not so high. If it's a new approach, if it's something that has been a recent diagnosis, the results are much better. But we have been able to obtain always improvement, inclusive in those cases that are very, very, very difficult. We have obtained some response, and that improves us, that makes us work and research going on for better types of treatment, always with autologous cells, without side effects, without any, there's no problem with them, because there's the cells from the own patient that we select to make the job. Fibromyalgia. Any chronic inflammatory disease is able to be treated with the system. Anyone, all chronic disease that do not have treatment at this moment, we will study them. Some of them we have already studied them, some of them we did not have the opportunity to study them, but we are on the way, and we will research for new approaches for all this type of sicknesses, because as we have been able to see, these incompetent, immunocompetent cells are able to modify all this chronic disease with inflammatory effects. We have been able to quit the inflammatory effect, and this makes that the body is able to reverse and is able to recuperate all the situation, and this person maybe not cured, but is free from the sicknesses. And maybe we have to be on contact, and we have to make a continuous approach to it, and we have to see how it goes evolutionary. But by the moment, our results are extremely high, inverse of all what we have on the pharmaceutical. They will give some pharmacs that would help, but they do not reverse the problem. And we are able to reverse the problem. And we are able to make the solution, maybe not the cure, but make the solution, and these persons are free of symptomological. The symptomology has disappeared, and they feel like cured, even though all the autoimmune problems, of course, sometimes it's very, very difficult, and we need more time, and maybe we need more sessions to make this reversion. But at the end, some of them we have been able to quit them absolutely, 100% by the moment. This is our experience. We have worked on 𝗁𝗂𝗧 side effects, persistent 𝗁𝗂𝗧, inclusive with, we know that there are some effects related with the vaccination, and these neurological effects related with vaccination, we have been able to reverse them, because it's an inflammatory effect related with the impact that the vaccination has over the immunitary system. Of course, that's what we expect from a vaccination, that is incentivizing the immunitary system to obtain a response. And maybe this response is not, in some cases, 1, 2, 3% of the population has a bad response to this activation, and they get this 𝗂𝗲𝗃 persistent, this symptomatology 𝗂𝗲𝗃, and we are able to reverse it because it's an inflammatory effect, and we are able to release it, to remove it, to minimize it, and to cure this person. And in this case, we have had very good. And not only this, people that had COVID, and after their COVID, they did not recover 100%. They recovered 30, 40%, 50%, but they continued with the neurological problems, with all the symptomatology of the COVID persistent. And we have been able to reverse it and to put them again working like if they had not had this problem. So these are the advantages of this innovative system. And not only in therapy, but in prevention, we have been able to work on what we call stop aging. In definitive, when a person is growing age, what the problem is that is increasing all the chronic systemic inflammation of the system. So if we are able to reverse this inflammation, we are going to stop all the effects of aging. And we have tried it, we have proved it. We have more than 100 patients that we tried it, and it's working perfectly. It's making the stop aging. People of 80 years old, 84 years old, that they feel like if they had 50, they feel like new. Of course, this is an effect that has a limited time of usage, that normally we count about 9, 11 months, and we have to repeat again, because of course, the inflammation is continuing, the aging is continuing, so we have to continually stop it. So we stop this aging, and this we have had a very, very good results, and I think it's one of the best effects that we found in preventive. So we have the curing effect of the immunotherapy competent cell and the preventive effect. Not only this, for young people that want to warranty that they want to have kids, they want to warranty that this fertilized egg is going to be excellent, that this child is going to have excellent possibilities to not develop sicknesses, to have a very good health during many, many years. So we can act over what we call the persistent toxicity of fertilized egg, and we can prevent it. We can remove it before fertilization and prepare it for the fertilization, and then this fertilized egg will have very, very good in the future. This egg will be an embryon and will become a human being that will have all the monitoring system prepared, and his well will be much better if we didn't do it. So this is a preventive effect of this type of system. So all these cells that are autologous from the same person, for himself. So no side effects, no counter effects. It's from the same person. We're going to use it. We're going to separate what we need. We're going to use it in a very innovative system and put them on the same person, autologous, no side effects, no counter effects, and obtain results that are out of mind in this moment for the most of the technologies that you know. This is something very new, and I hope you will be able to see all the good effects that we will obtain with these treatments. Dr. Vidal?
Yeah.
You want to say
Okay.
anything about cells?
Yeah, over you. Thank you. Thank you so much, Doctor. So let's explain you a little bit, because I think this I need to take probably, I don't know, about 5 hours to explain our approach. More or less. Takes much time. Well, first, we like to talk a little bit about our approach, how we design our strategy. So one of the things are, for the information, we are in cell therapy. Okay, the context is cell therapy. So once we are in cell therapy, we move to cellular immunotherapy. So, as you probably understand, we use cells for treat immunological diseases. So we are moving around the immune system. So this is our approach, which is for us, it's a really, I would say, pleasure to treat patients like this. And then it's really nice that probably it's very simple. Well, I don't know, quite simple probably. But our start product, probably you understand we are manipulating cells, probably you think that we are probably changing some genes or so, whatever. As Dr. 𝗏𝗏𝗏𝗏𝗏 explained, it's autologous. We use our starting product is the peripheral blood, simple peripheral blood, but we treat it another way. So we treat in order to collect our best immunocompetent cells, which are used for potential the immune system or reverse, as I explained my colleague, to the inflammation. Most of the inflammation is the chronic inflammation. So now our approach is not for acute pathologies, inflammation, acute side effects. Not our approach. So we are focused most of our treatments is the chronic, which is as my colleague explained, which is the main problem in the aging. Aging means many autonomous pathologies, okay? Even metabolic pathology. So, for example, we don't use bone marrow, we don't use cord blood, we don't use we use simple blood, peripheral blood product. Okay? So I don't think I had to explain more because if I probably understand, I can explain the details we are doing in the lab. And then the only thing is really interesting is we use cell therapy for human use in treating those pathologies which today is not way to be treated. Okay? So I think I don't want to explain more. I mean, it's going on. This is the context. So thank you. I'm just taking the please. Okay.
And thank you very much.
Thank you, Chairman.
Okay, let's now go in for our expansion plans. Then as Dr. 𝗏𝗏𝗏𝗏𝗏 going out of one of our medical centers, is not able to connect, and then I will share with you our plans, and then which are the next steps of our project. First one, in 2022, we are just negotiating, and we will be able to announce in some weeks, probably less than some months, and during this year, we will open the first international medical center of Aitness, based on immunotherapy and advanced medicine treatments, as Dr. 𝗏𝗏𝗏𝗏𝗏 has been explained. And this will happen probably before this summer, and we will start opening these treatments to the international market. Okay. Then, and what's next? Next, in 2023, we have planned to open in Switzerland another medical center to also be able to continue expanding our knowledge and treating more and more patients. This is based on our medical centers. What else? We are, as you may know, because some of you are just now connected, we are arriving to some agreements with medical agencies or medical tourism agencies, and we will continue in the next weeks closing these agreements. We have all the medical and scientific department able to share with you our experiences and mainly the results that our patients are reaching with these treatments. And then this can be shared with you, and also we can provide you a process in which manage all the diagnostic and prescription process to each one of your patients. And on the other hand, we have been closing agreements with foundations and with universities and research centers, and also we invite you to join us and to cooperate in this amazing research that will really change the health and the wellness of so many people all around the world. This is our vision. We will do it, and you can join us to make it possible. We are waiting for you. And after this, we have been receiving so many questions in our chats. You are asking us so many questions, and then I will try to share the most important, and I will ask Dr. Roster Tales and Dr. Vidal to please answer our guests that are asking us. For example, Dr. Roster Tales, our patients are asking us, how can I know if this treatment is idoneous for me?
Okay, the first step before making a treatment with any patient, the first step is studying the patient. We're going to make most of the patients sure they already have made the trial, they already have a diagnosis, they already have a medical resonance or medical analysis, or they have already a history that we already have the diagnosis. So we're going to analyze all this information, and perhaps in many cases we will make our own analysis, because we want to be able to check the results. So we want to do it with our parameters, and probably most of them we will have to repeat some of the analysis, only to have an homologous sheet of results, and we can see if this is working or it's not working. So we have to know, only to make the presentation for the scientific community, we must give the results. We must give objective results. Not only because I feel better, not only because I have less symptoms, but we have to give objective, and we have to demonstrate. But we have already demonstrated, and we are going to continue demonstrating that this is working, but we will have parameters to analyze, and parameters that can be shared with anybody, that can be given to the scientific community so they can see the results. So the first step would be analyze what we can do for any type of sickness, because I understand that now imagine you have, I don't know, any sicknesses that maybe at this moment I don't think on it, but a chronic disease, any chronic disease that does not have treatment, we're going to study it, because that's our challenge. Our challenge is these sicknesses that do not have treatment, that maybe we can have an approach to improve it, maybe to solution it, I don't know. But we will analyze it, we will study it, and we will give a result, and we will give this person, we will tell them, look, this is what we can do for you. And at this moment, after this, the patient decides. In some cases, we already have tried it, we already know it. Some of the sicknesses, of course, somebody comes with ulcerous, ulcerous colitis. Ulcerous colitis. We have obtained cure. So I'm going to say, look, I don't know if I'm going to cure you, but we're going to go very close to curation. Maybe not immediately, but maybe we will need a little some sessions. Maybe we will be working 1 or 2 years, maybe with you, making all that, but we will obtain the result, because I already know it. We know it. We have already tried it. We know that this works. But maybe you come with a pathology that I don't think of at this moment, and we don't know it. We will study it. Our scientific group is going to analyze it, and we're going to prepare an approach and tell you, this is what we're going to do. We're going to use this type of cell, we're going to use this type of approach, we're going to use this type of treatment, and you will obtain the response, and you decide, then the person decides if he wants to make the treatment or not. We will give him a solution. That's our idea. Give a solution for all these pathologies that nowadays, they don't have solution. They don't have inhibition of the inflammatory system, inhibition of the immunitary system, or etc. So nothing useful, only give a better quality for the symptoms, but nothing else. We're going to try to find out the solution, but we have to study it, and we will study it. Before doing nothing, we first study it. After that, then we prepare the approach, and then we give it to the patient decides.
Thank you, Doctor. We have a question.
If you have questions, please give them now, because I'm willing to answer all the questions you want.
Okay, we also have a question for Dr. Vidal.
Yeah.
Please, they are asking us if you can explain which innovation and advance in the field of the medicine represent our institution and our practice.
Okay. Okay, let me explain a little bit about that. Maybe you understand this is really wonderful approach, but we already have our limitation. So we are doing our best, but we have limitation. So as you know, in the field of the autologous city, so of course, if you have a disease, you have a chronic disease, you have affected yourselves. Okay? So if you are affected yourselves, the only thing we can do is trying to get from your blood your best cells. This is our advantage. Okay? Our advantage is that most of your cells, as you are ill, are affected. So don't expect a huge results if you have a very, very bad condition of your cells. So this is autologous. Otherwise, as you probably know, most of you, in an allogeneic setting, we are taking too much risk. So it's out of our approach. So it's not our approach. So our approach is autologous. So limitation. How is your cells? You are in good condition. So we have experience about 80 years old patients, which is excellent results, and also we have bad results in young people. So we don't know sufficient right now to understand which is the part of the cell which is going to act against the disease. Any question about?
Yes. You are talking now about autologous. Yes. And we have a question talking about what if we are using another kind of processes like heterologous procedures or some other medicines that have been used in the last years also for immunotherapy. We are using it or not, and why?
Okay, so as I was commented previously, so we are using cellular immunotherapy. So basically, we use immunocompetent cells. We are not used like the others that use antibodies for immunotherapy. So we don't use antibodies. We are normally manipulating the immune system. We are potentially we are giving more good condition in order to resolve the problem, the pathological problem we have. So they have chronic patients. So think about it that we don't have any reaction, immunoreaction, because it's not like heterologous, it's autologous. So that's the big difference, that we are able to prepare products in order to don't have side effects, in order to have a reaction against the body. So that's the basic concept we have already. Okay?
Okay, thank you very much, Dr. Vidal. Dr. Lohster-Tales, we have two last questions for you. The first one is a direct question. It says, how can we cooperate with your institution as a medical center or as a medical tourism agency, and how have you planned the diagnostic process of patients all around the world.
Okay, the idea that this is a new approach, a new therapeutic approach that has a very high effectiveness, and of course there can be many benefits all around the world. It's a difficult technology, it's not easy. It's individualized for each person, for each case. We're going to use a special protocol. So that means that for every patient, we will use a special type of therapy. It's individualized. Okay, that makes it a little bit difficult, a little bit more difficult. But of course, we will have much better results when we are making this type of therapy for this patient. And it's not the same one that we will use with the other patient. No. We will use other type, using the technology. The basic technology is the same one, but we're going to study it and we're going to direct it to what we want to obtain in every type of patient. So it's going to be individualized treatment. And of course, we need the support of institutions. The support, we have already some support of institutions, of the research, of the university, of some governmental statement, and of course, medical tourism. It's important. It's important because there's patients that are going to get benefits from these type of treatments, and will give us more information, and will give us more data, more results. And of course, we're going to obtain the results. We know it. It's going to work. How much? I need 100, 1,000 patients. Now we have 5, 10, 15. No, I want 1,000 patients to know this is working. This is really working. I want to know all the data. We're going to analyze it. And for this, we will get all the support that we receive from any institution to research. Any type of research in this field it's not cheap, it's expensive. So this must be supported by patients that are going to get benefits from treatment, are going to maybe not cure them, but we will obtain some result that he will almost feel this cure in some cases. And he will feel, well, I'm free of sickness. We have a lot of experience in this. There's patients that say, look, doctor, I don't know if I'm cured, but I feel so good, I feel so well that I don't have no symptoms. I'm cured. I say, no, you're not cured. We still have to be checking what's going on. And we will do it. We will check on it. Of course, any support is going to be grateful. We're going to say, thank you. We need it. We need it to continue because this technology is going to work. It's working. And the results we're going to obtain will be out of limits. We already know it. Thank you to Dr. Vidal. He thinks on every time we have a patient, we prepare for them. We think on it. We work. We have a workshop. And we decide, look, we're going to do this style, and we're going to change it. We're going to modify what this. Autologous, always autologous with the own cell of the patient. Of course, sometimes the patient is so weak that it's difficult. We will need more time. We will need more insistence to obtain the results. But we already know it. We will tell them, look, as you are so weak, maybe not in the first moment we'll not have a lot of results. We'll have to wait maybe for a second or third period to know what's going on. But at the end, we obtain results. In all of the cases we've done, 100%, we have obtained results. 100% results. In some cases, the result is limited, it's little, but of course, there are cases that are very, very difficult. In some cases, we have obtained a complete resolution of the problem. And we need the support. We need incomes to make the research, to prepare all these patients. And we need patients that we have to treat them. All these patients, difficult to treat. All these patients that have problems that cannot be solved another way. We have a solution. We're going to make a solution. We're going to design a solution for them. Individualized, especially for them. And we will obtain results. 100%, I don't know. I would like to say yes, we had 100%. No, well, I said we will have some results. Some results. We tried multiple sclerosis. Multiple sclerosis. You know, the selection was, give me the most difficult ones. That was the solution. Give me the most difficult ones. We tried it in the most difficult. And in the most difficult, that was structured 20 years of multiple sclerosis. That in wheelchair, the people that really were in bad conditions, and we obtain results. That's what we want. We obtain results. 5%, 10%, okay. We are speaking about a very, very difficult case, but not maybe cases that are more smooth. We will solution them. But cases that are really difficult, we will make some solution. But we need support. We need incomes. We need to research it. We need to give it to the scientific community to say, look, we have a solution. There is a solution. The solution is autologous cell, immunocompetent autologous cell has the ability to move the system and to recover the health. That's the idea.
Okay, thanks, Doc. And the last question, because our chat now is burning when people is hearing you, is okay. We have patients that we believe that you can improve their health. How can we do it? To contact with you, to contact with Aitness, and to send you the information to obtain a diagnostic and a proposal of treatment for them.
Okay, the idea, I think that there's prevented, some type of web, that you will be able to contact and to send the approach. First of all, well, we have this patient, blah, 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 you can send, nowadays with the technology, you know, you scan me the documents, we will analyze it, we will study it, and we will say, well, it's possible that we can do something, or we think we cannot do nothing. We have to analyze it. Every single patient, we will give him some solution. Maybe the solution will be, it's not able to do nothing else, but most of the cases, probably there will be things to do, and in some cases, now think on this. Think on the preventive effect. This treatment has a preventive effect. There's many people that can get benefits from the preventive effects. Every people gets aging. Everybody gets aging. So many people can, you know, you can stop this effect. You can stop this degeneration. You can stop it. So come and stop it. And this will give us incomes to study difficult sicknesses. And this will give us, and you will get the profits. You will get the benefit of stopping aging. You will get the benefits of having a very good, look, you have 75 years and you feel like if you were 40. Is that a good idea? You can obtain this. We have already done it. We did it. So we know we can do it. There's a preventive effect. And this will give us incomes for these cases that maybe we will find a solution. Not complete solution. We will find a solution. These people that are suffering with sickness that does not have treatment. And we will give them a solution. Some solution. And without side effects. Without counter effects. That's the idea.
Okay, thank you, Doc. If you want to close the session then.
Okay. Well, I think that
I think you have to join.
Okay.
yes, please come here.
Thank you.
Thank you. Okay. So I think that mainly Dr. Vidal, please. The scientific director come here. Because he is the aim. He is the aim. I'm only the doctor. He's the aim. He is the one who prepares the cell. I said, Dr. Vidal, I need this cell. And he said, let me check, let me think. Sure. And after 48 hours, he says, I have already the cell you need. Okay. Thank you. Thank you. So we're going to work for you. We're going to work for your patient. Your patient is going to have benefits. This is going to be a great treatment. We know it. We have already tried it. We know it. It's going to work. It's working already. And now you only have to send us, and we will study it. We will analyze it, and we will give them a solution.
Thank you. Thank you.
Thank you very much.
Thank you very much for attending.
Thank you very much.
Thank you very much for your attention, and please contact us. We are ready to help you from now on when you need it.
Okay. Thank you very much.
Thank you, and see you soon. Bye-bye.
Bye. Bye.